Hello again, Nicholas Markey here with Beach Barbell Physical Therapist. I am a physical therapist by day, and by night I am an online fitness coach. Anyways, back here for another video. Hopefully that will be informative and helpful for you. What I wanted to talk about was what I think, and probably the research shows, what physical therapy should be, okay? First and foremost, it should involve education. Basically, it should be one, teaching you what we think is going on, right? And this is not just some of the dogmatic stuff that's kind of stuck with our profession like a zombie. But you know, where the actual research is going, and you know, some of our uncertainties as well. So I harp a lot on back pain. One of the top education points I always like to talk about is that herniated discs and degenerative disc disease, which is again the scary sounding word for arthritis, are oftentimes not related to someone's pain, or at least per the research. Lots of people can have those things on imaging and have absolutely no symptoms and be completely functional and doing everything they want to do. So it's important to educate someone on that. And education might actually be kind of like, just like with training, gradual. So if someone comes in with a very firm belief that their back is out of alignment, or their discs are just blowing up, or their degenerative disc disease is just grinding, you know, there's those, you know, nasty, scary thoughts, you know, the education may be a little bit more gradual, and it might not just be words. It could potentially also, oftentimes I like to share a very popular YouTube video by Lorimer Moseley, a snake bite story. Lorimer Moseley is a physio in Australia, and he does a lot of research on pain in particular. And so he's very funny. If you think of education and kind of entertainment, kind of blending those in a good way, oftentimes we'll onboard that better onto our brain because it's more enjoyable. And the entertainment and maybe humorous parts of education, you know, if it's actual like legit science, because it could be used for ill as well, unfortunately. If the education is kind of mixed with humor and, you know, sort of entertaining, it kind of bypasses a little bit sort of our defense systems, our belief systems, okay? So, so for someone that maybe has a very firm belief that they're, you know, for instance, their back is just no good, they got a bad back, it's going to explode, they were told so, they have MRI to prove it, yada, yada, yada. We don't know if that's true or not. So part of the education might just be mixed in with some of the other aspects that I'm going to talk about here, you know, and kind of happen, you know, in between sets of exercise, right? When somebody's kind of feeling more trust between us, you know, between me, the physical therapist, and them, the person that's trying to hopefully change for the better, right? Another thing is reassurance. So reassurance is not just going, you know, patting someone on the back and saying, there, you'll be all right. That's part of it. But, you know, I like to think from the kind of broad analogy, reassurance would be kind of like, you know, the good parent. When your kid falls down, you know, what does a good parent do, right? You know, they help the kid up, they support them, they show them love and compassion, but they don't necessarily freak out and coddle them, because that can turn the situation, you know, maybe into not so great, right? You know, they provide that support and compassion and empathy, but then they also have that encouragement for their child to keep going. And so we are still that same human being that wants that needs that, right? So when we get hurt, we want someone to tell us it's going to be okay, right? And so if that's coming from someone like a physical therapist, a medical provider, who perhaps, you know, has some trust from this person just implicitly, then we potentially have some power to do a lot of good there, right? Someone comes in with maybe back pain and, they're freaking out. Maybe they've heard so many different things. What the heck do they need to do? And then, we calm them down. Hey, let's take a deep breath. Let's talk about this. Let's make some jokes, make them feel comfortable, happy. They're like, wow, this person's really nice. They really seem to care about me. And then we try things, we test things. So reassurance isn't just words, it's actually maybe testing movements. So I like to have people, like, again, I'm using low back pain because it's a very common thing. I like to have people with low back pain pick up some weight off the ground, right? Because that oftentimes is something that's very scary for someone with low back pain, maybe something that oftentimes will, increase their symptoms. I give them a little bit of weight, 10, 15, 20 pounds, something that seems reasonable, initially, and have them try to move it up and down. It's just a deadlift, it's just an exercise. And that could be a level of reassurance as well. So they're with, the context, if you look at the context, they're with an expert, the physical therapist here, who they trust, they like this person, this person seems very nice, and then they try a movement that seems scary, but then they try it and they're okay, their back doesn't explode, and maybe they're gonna be all right. And then this then bleeds into the third part, that physical therapy is exercise prescription. Unfortunately, a lot of our profession, people in our profession do not prescribe very well. They just give like a basic 3 sets of 10. And that's not to say that 3 sets of 10 can't be an appropriate prescription, but oftentimes the dosage, so if you think of dosage, just like a doctor might give you like ibuprofen and the dosage is 500 milligrams or whatever, the dosage of the exercise, we want it to elicit a response in your body, right? We don't want it to be so low that it's not really doing anything to your body, like for the positive end, like it's not making your muscles and bones and nerves and all that stronger. Now, again, someone going to physical therapy is probably maybe having some pain, so we do have to respect that. And so there are some of the exercises we may be doing may not necessarily be pushing like the muscles to their end range where you're getting like a muscle pump and a build, okay? But if we push it to maybe the end range to what their pain tolerance might be, maybe not trying to like go over it all the time and really tick off the pain and make the body more pissed off, but maybe going right up to it, kind of showing the body that, again, this is the reassurance part, showing the body that we're okay, look, we're not exploding, we're pushing ourselves a little bit, this feels a little hard, so we can actually maybe build up, you can say, the confidence, the strength in terms of just the ability to tolerate and produce force, right? So maybe this person without pain can lift 100, 200 pounds or something, but with this pain, they can only lift 50 because their body's kind of capping them, okay? So maybe we work up into that, but over time, maybe they lift 60, 70, 80, 90, 100. Maybe we get them to that point where they can actually push their muscles, with that particular movement, and be able to improve like muscle, hypertrophy, which is, the size of the muscle, okay? So exercise prescription, and it doesn't just relate to maybe progress, so like progression of exercise, like, okay, we did 20 pounds this week for 3 sets or whatever, and you did really well, you tolerated it, things are going well, let's go up to maybe 25, 30 pounds, right? So kind of gradually, building a progression. It also is regression as well. So what if we were making decent progress and then, there's a flare up or, something happens, right? Maybe they don't tolerate it. Okay, well, can we regress it? Can we bring it back down? Absolutely. And that also might include maybe switching it up. What if for the first 4 weeks we're working one exercise and things are going well, maybe it plateaus, maybe they get to a point and it just doesn't feel tolerable at a certain point for whatever reason, but maybe we switch it up. Maybe we switch to a different exercise and start to build that one up. So exercise prescription has a lot of little variables that physical therapists should be very good at. It's why I don't mind kind of giving myself the moniker of a medical personal trainer. Hopefully personal trainers, not all of them or many of them know how to do this either. But the exercise prescription of, the dosage, the variations and that kind of thing. And then if you couple that with someone, having pain, and then you got to kind of, work that around that as well. So, and then like I said, that kind of bleeds into kind of education and reassurance. They all kind of bleed into each other, right? It's kind of a whole, if you look at a holistic picture of it. And then the final thing is kind of the medical screening aspect. And this is where the medical part comes in from the physical therapy angle. So somebody comes in like with, they say hey, I fell down on my right shoulder. And you're like, okay. And then they can't, they show positive tests of like, they can't lift their arm. We have a drop arm test where we lift it up for them and see if they can lower it, and it just falls down. Those cases may not be the best for physical therapy. Now, you can kind of leave it up to the person and say, hey, look, I really think you might need based on this case, based on what your history is, based on our examination, I think you might need a referral to like an orthopedic doctor, because it's very potential that you have like, in this case, maybe like a torn rotator cuff, okay? Your call in terms of, do you want to attempt some physical therapy? In this case, this may be more appropriate to see the ortho, but it may not be a bad idea to also try some physical therapy in the meantime. We've had cases where somebody had a torn rotator cuff and they actually got stronger and better from doing the physical therapy without surgery. So, there are cases that can happen. And then even then, if someone is going to need surgery, say they go to the orthopedic and the doctor's like, yeah, your rotator cuff's completely torn, we need to do surgery, but your surgery is going to be in a month or 2 months from now. Well, is it a good idea for that person to sit around and do nothing, right? So that's where maybe a physical therapist, what we might call prehab, would actually work with the person to try to beef them up, get them as strong and ready as possible for that surgery. And the outcomes for people doing prehab are oftentimes way better than if they don't, okay? So kind of that medical screening aspect, and that doesn't just apply to kind of musculoskeletal type stuff like, muscle tears and stuff like that, but it could also be other symptoms that may be related to other systems, right? If someone's, for some reason didn't tell their doctor this, but then tells us, the physical therapist, some other condition, right? Could be stuff like related to mental health, like depression. We have kind of like an easy depression screen. Somebody pops positive on that. Then we can talk about that and say, hey, look, is this something you want to get help with? And then let's maybe try to find them appropriate referral on that end. So lots of little aspects to that. And so basically the physical therapist is another member of the team, right, of this medical team. Like if you think the patient is in the middle, they're the one in the driver's seat and they got all these different parts, different team members, right, trying to support their health, right? Their primary care doctor, their physical therapist, maybe if there's a registered dietitian involved, maybe if there's a orthopedic doctor involved, maybe an endocrinologist, whatever aspects to their health that they need, some sort of, support on. We are another member of that team, and a physical therapist should support those team members, right? We should all be working together holistically for you, the patient, because you're the one living in the body that's experiencing and trying to thrive in life, and we should be focused on that and not ourselves and what it does for us. We should be focused on what we can do for you. So anyways, thank you for watching, and I will keep these videos coming because they're kind of fun to do. And if you can like, share, subscribe, whatever, it helps me out, and certainly comment and let me know what you think as well. So anyways, again, I'm Nick Markey, and I will see you next time. Goodbye.